Throughout history, cannabis was labeled a gateway drug, meaning that it could lead to more dangerous drug use. Now, some are saying that cannabis could be an exit drug instead. And Dr. Fry, I want you to explain what that means, exit drug.
So we're using cannabis now to get people away from harder medications like narcotics and alcohol. So one of the things I like to do is take patients who are on multiple medications like Percocet, oxycodone, Vicodin, and start weaning them off with cannabis. And then ultimately the goal is to take them off cannabis as well. And that's the meaning of an exit drug.
I want to ask you, because there's two elements here. You know, people go on these drugs, the narcotics initially to treat pain. They become numb to the pain, but numb to life. And so this is very new. And FYI, everyone watching, very controversial still as well. But in your opinion, how is it working?
So it's two different, I think of it as age levels. So if you're in your younger years, your 20s and 30s, those are really what we think of as more of the addiction patterns. And when you're in your 50s, 60s, 70s, and 80s, I don't think of those as much in terms of addiction, but dependency. I hurt my back at work, and now my doctor put me on prescription painkillers, and now I can't get off. Now with the opioid epidemic, we're seeing doctors being pushed to take patients off of medications without having a nice exit plan to get off. So what we're using it for is twofold. Number one is to help with the pain itself. And number two is actually the withdrawal symptoms from the narcotics. So as you wean patients off of narcotics, very often they have diarrhea, they have nausea, they have vomiting, they have sweats. They have all of these things that we know of as the clinical opioid withdrawal scale. And that problem is preventing patients from getting off narcotics.
Couple questions. How successful is this?
It's been very successful. Again, this is something I would suggest patients do with the care of a physician. I would not suggest doing this alone.
Right. That was the other point I was going to make. That
yeah,
people are going to
100%.
hear this and go, okay, I'm gonna do this myself, self-medicate, try to get myself off one drug and.
Correct, and onto another. That being said, as long as you do it under the care of a physician, we're seeing enough successes out of this that pharmaceutical companies are now taking a look at this and are going to start packaging and labeling and doing trial medications with this.
And in fairness, what you're acknowledging is that this is experimental. Others disagree with this approach, one being addiction specialist Ken Seeley, who joins us now. Ken is on Skype, and Ken, you've been on our show a number of times, and we applaud you because your passion for helping people who are addicted is special. In your opinion, you've mentioned this on our show before, you do not believe cannabis is an appropriate exit drug. Why is that?
Yeah, I just don't agree. I think that, right now we have 70,000 people dying every year in this country in a crisis. We talked about it many times on the show that if cannabis wants to be a medication, as everybody's talking, it's a medication, then why isn't the FDA approved it as a medication? I don't agree. I think it's a horrible decision. I think that, I go to a lot of meetings and I speak, and when I speak in public and I say, how many of you that are drug addicts and alcoholics, raise your hand, how many of you, the first drug you ever tried was cannabis? And over 80% of the people raised their hand. So if that's the gateway drug, why are we giving them that drug to get them off of drugs? It doesn't make sense to me.
But Ken, I do want to challenge you on one thing, which is, as a doctor, I certainly do not use the FDA as my litmus test as to whether or not something is effective, and that's just the truth. I know they're doing the best that they can, and I also acknowledge that it's experimental, but it's hard for me when I'm listening to stories from Dr. Yafai of a senior who's in their mid-70s and hurt their back, and now they're dependent, chemically, physically dependent on opiates. In a scenario like that, why would you disagree with maybe transitioning to cannabis versus not?
No, I know people that it does work for pain like that, but the criteria that we have set, when it was legalized in California, I know an 18-year-old that went into a doctor's office, said his back hurt with no back pain prior, got a prescription for it, and walked out being able to buy cannabis. So the reality is it's not, the criteria isn't there yet. The research isn't there yet. Yes, it does work for pain, but we need the criteria to tell us what's necessary for that type of pain versus anybody saying, oh, I have pain, I need a prescription, or I need to use cannabis. It's a gateway drug. It's killing people.